Greetings. I want to share my experience with you on umbilical cord tying around, wrapping around baby's neck. And the experience was that was during my youth service. During my youth service, so I was working. They posted me to a private hospital. Yeah, they posted me to a private hospital, and I was working there. There was this woman they brought that was in labor. The labor was progressing fine. The heart rate was the heart rate was the baby's heart rate. What I mean now, the baby's heart rate was about 130, which is normal. You know, the normal is between 120 to 160. Baby's heart rate was 130. Everything was fine. We were they have some facilities. There's what they call sonicade. They will put it on the woman's tummy. You'll be hearing the baby's heartbeat, boop, 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 boop. And heart rate was fine. Labor was progressing and everything was okay. The woman was occasionally shout when the pain comes. She was contracting where everything was fine. Then all of a sudden, I say, okay, let me check the baby's heart rate again. I noticed that the baby's heart rate has gone down. I was now getting 60. 60. I say, what could be the problem? Why is this baby's heart rate going down? And the mother now said that the baby's movement have reduced. I was getting 60. I checked again. I got 60. I got 60, 60, 65. I now called the nurse that was with us, that was with me, that we were taking the delivery together. And I said, okay, nurse, so please, you check this heart rate for me. Let's be sure. Then the woman was already 6 centimeter dilated. She was getting close to delivery. Just 4 centimeter remaining to deliver. And now say she's getting 62. I say, this is fetal distress. They call it, if you're a nurse watching this, you understand what I mean. They call it fetal distress. This is fetal bradycardia because the heart rate was going down. That's bradycardia. I had to tell the woman that, madam, your baby is in distress. When I did the examination, I checked the baby. I noticed that, the woman was already 6 years now. I was touching the head, but I was touching the cord, the umbilical cord. Yes, I was touching it. I tried to take my hand. I noticed that the umbilical cord was wrapped around the baby's neck. I just told the woman, madam, it's cesarean session. By then, we have called the sonographer. The lady, she did scan and she just told me that, doctor, the cord is around. In fact, you will see it wrap around the baby's neck. Distress. Before we know, we brought the patient to theater and the woman had cesarean section. And the baby was delivered, the cord was wrapped around the baby's neck. In fact, the eyes were protruding, right? The eyes were protruding. Like somebody tie rope around your neck. That's how it is. And when I'm saying this, luckily the baby survived. Until now, till I left my youth service, the woman kept on telling people about me that doctor saved my baby. And one thing I appreciate the woman for is that she did antenatal in that hospital and she has been counseled very well by the nurses, by the doctors that see pregnancy, delivery of baby can go either way. You can do CS, you can do the normal, you can do a birth canal. You can go either way. The labor is progressing normally does not mean that it will not end the CSO. Anything can happen. I told you the woman was already 6 centimeter dilated. Just a matter of time. Just in 4 hours, she will deliver. So the baby came out. If you even see the baby's neck, you will see how most babies that are giving birth to, they are fair. You can see the redness around the baby's neck. Redness when we remove the unclamp, the cord wrapped around the neck 4 times. So the baby, we resuscitated the baby. Baby is fine. Baby is fine. I even saw the baby about last year. Baby is doing well. Started kindergarten and the rest. Now, why am I saying this? The reason I'm saying this is I posted a video about the dangers of umbilical cord wrapping around baby's neck because I know a lot of women have lost their baby in the last minute. Some women have had stillbirth because of cord wrapping around the baby's neck. I mean, my intention is not to scare you, but my intention is to educate you. Some women have had stillbirth. Some women, they'll tell them, cord is wrapping around your baby's neck. They'll say, no, I must push. I be this kind of woman. No. If they tell you cord is wrapping around baby's neck, it's an emergency. And let me also tell you one maneuver I did, which is recommended. Immediately, we noticed that cord was wrapping around the baby's neck. I just told the nurse, and we need to do this. Because before we prepare theater, do this, before we bring patient to theater, it's a matter of time. And when cord wraps around baby's neck, you know what it means? It's the head that contains the brain, right? And all those vital structures are in the head. When cord wraps around baby's head, this is what it does. It cuts off blood supply to the brain. And you also know the neck has where the baby breathes through, right? It blocks the airway. It blocks the throat. Baby is not able to swallow. Baby is not able to breathe very well, right? The brain is starved of oxygen. So sometimes the baby is born, the baby will not cry well at bed. The baby will not have cerebral palsy later. I'm going to take time to educate some of us on some of these things. The baby will not have cerebral palsy later. They'll say the baby is not doing well in school. The baby is not sluggish. Baby is not crying well. Baby is not sucking well. The baby had ischemic encephalopathy, that is brain injury during birth. That's what happened. Most of the cerebral palsy you see today. So now, what I did was I passed the catheter and I pumped the bladder with normal saline water. You know why? I filled up the bladder so that the bladder will like push on the womb. There's a mechanism for that. We push on the womb and reduce the strangulation of the baby's neck. Like if the bladder, the womb is stretched, when you pump the bladder will like push the womb up a little and reduce the stress, the strangulation of the baby's neck. If you find yourself in such situation, that is what you should do while you are willing the baby to theater. That's what I did that day. And baby came out well. Why am I saying this? I posted a video on cord wrapping around baby's neck. Somebody said, though it was that the comment was later deleted for missing because TikTok said it was misinformation. They deleted the comment for misinformation because that topic is too critical for you to just say things, anything you like. So TikTok I just saw that they blacklisted that comment. And look at it, they said deleted for misinformation. Say, okay. When I saw the comment, it said I'm just causing unnecessary scare. Person said I'm causing unnecessary scare that the cord, somebody told her that cord can wrap around baby's neck, that's no problem. That the cord will unwind later. If cord wrap around baby's neck, no sonographer, no sonographer, when you go and do scan, those people that do scan will see cord wrap around baby's neck and tell you no problem. They will tell you to use your two left leg. That's how we say it in my place. They will say you should use your two left leg to run to the hospital to see your doctor. That's what they will tell you. It's an emergency. Nobody is waiting for the cord to now wrap. See, imagine as an adult, something is tying your neck. Rope is wrapped around your neck and is tying it. Yeah, instead of losing it or doing something about it, you say, don't worry, naturally it will unwind. That the cord can unwind. Well, I'm happy that TikTok deleted because that was gross misinformation. Umbilical cord wrapping around your baby's neck is an emergency. It becomes a matter of life and death. I told you now, the cord, for that, my experience, I told you, the cord wrapped around the baby's neck 4 times. 4, that means he kept on choking the baby. Please, watch this video and listen to what I'm trying to tell you. Because me, one thing people know me for, I know Sabi, I'm not a people pleaser. I just tell you how it is and rest. And you can't know how you want to. Because we should be careful of statements we make. I know many ladies that lost their baby from this umbilical cord accident. This umbilical cord accident, that's what they call it. Oh. Umbilical cord accident. Because the cord acting as a rope wrap around baby's neck. The baby will keep on, when the baby keep on moving, the cord keep on wrapping. So you are waiting for the baby to start moving back. Does the baby have that intelligence to start moving back? So that the cord will not. The baby can keep on wrapping around. And you can say, so have you seen some people are born without hands? It's because the umbilical cord or something wrap around the baby's hand, cut off the baby's hand, reduce blood supply. So those are umbilical cord accidents. They are serious, right? There are serious accidents that happen in the womb. An accident can happen in the womb. So when umbilical cord wrap around baby's neck, that's not when to say they told you it's normal. It's not normal. There's nothing normal about that. And please, let's be careful of this misinformation we carry around. There's nothing normal about cord wrapping around baby's neck. Oh. If it was normal, let me tell you, the cord will be just you as the baby is formed, cord will be wrapped around the neck. So when you see cord wrapped around baby's neck, it's an accident. That's why no sonographer will see it and tell you to relax. No, will tell you hospital straight. When you get to the hospital, the doctor will examine you and check the heartbeats of your baby. If they notice that the baby is not doing well, the heartbeat is dropping, or the heartbeat has gone too high, that means the baby is in distress. That's fetal distress. And what do you think they do for fetal distress? Cesarean section to bring out the baby. So many women have lost their baby from these simple things. So don't bring one person told you this. There's nobody told you anything. Please, please, I will not like misinformation on because this page was actually created for education. And anything I tell you here is researched. It's research. If you doubt me, if I tell you anything, ask your doctor. I know how many people I talk with before I even shoot a video that is reviewed. They look at it. They look at it. Okay, this if it's the one that is beyond, I go and ask. I have the good thing about me. I have access to a lot of people, professors, consultants, and the rest. So I ask. I say, okay, this. So don't think I just come here and I just start telling you. I don't just come here. Anything I tell you is well researched and also based on experiences. You may think I'm young, but I have a lot of experience. Because I've seen many things. So that is it. Oh. When you are told that your baby cord is wrapped around the neck, cord is wrapped around your baby's neck, it's an emergency, go to the hospital. When you get to the hospital, they will evaluate the baby, they will do another scan. If they do another scan and find out the cord that's on one, good. If they do another scan and find out the cord is still there, now CSO. So it's not something you wave away. You as an adult, would you like somebody to tie rope around your neck and say, don't worry, the rope will unwind? Imagine they pull rope. I wish I have something that I can use. Okay, let me use this. This is how it is now. You pull rope like this. You keep on going round. Keep on going round. You are saying, look at it now. And you know the baby is moving. The rope will keep on tightening. Even right now as I'm here now, I'm already uncomfortable. And you know the rope can be long. Keep on winding round. To the extent that I said that baby's eye was bulging because it was much. The pressure was much. The umbilical cord that wrapped around the baby's neck even left a mark on the neck. The neck was red. You can see it's a serious thing. So please, in a bit to prove something, we should be moderate in our conversation. We should research anything we say, so that we will not start saying some funny things. So that we will not start making funny statements, comments that will mislead people. This page was meant to educate people, not to mislead. I noticed that people watch my page. I didn't even know. A lot of people watch this page. Even people, I don't want to say because it will look as if I'm bragging, but it's not bragging. I'm just letting you know that there are many healthcare professionals that are also following this page. including some